Welcome to the Secrets of College Planning. I'm your host, Anthony Uva, and today we're going to get some insight into brain, spine, and sports. My guest today is Dr. Dhimant Balar, and he is from Princeton Brain, Spine, and Sports Medicine. And welcome to the show.
Thanks for having me.
Yeah, so usually I start my guests where they went to college. So where'd you go to school?
I'm a Rhode Ram. So I grew up and went to school in Rhode Island at the University of Rhode Island.
Great. Yeah. So let's go back in time. How did you end up picking University of Rhode Island? Was it the only school? Did you start as a freshman in high school or a senior? When did it all begin for you, and how did you end up picking that school?
The long story and abridged version basically is I'm from Rhode Island. I grew up there, went to high school there. And I always knew I wanted to do medicine. But I needed a backup. And I had I really had one backup. I wish I had two. The first one I wished I had was playing baseball. So University of Rhode Island was one of the places that I could have potentially played intercollegiate ball. But it also had a good pharmacy program. So if medicine didn't work out, I was planning on switching into the pharmacy program from a chemistry background. Okay. And at that time, University of Rhode Island had a very good or very reputable, and I think it still does, a pharmacy program as well as Rutgers. So that was a sort of lean into University of Rhode Island. Unfortunately, during my senior in high school, during a playoff series, I fractured my wrist.
Oh.
So that was late in the season, so there goes my fall baseball into freshman year. And by the time I finished my freshman year and getting ready for spring, following year, I realized I wasn't bright enough to do my 5-credit chemistry courses and 4-credit biology courses. So I decided against playing intercollegiate ball and just playing more intramural or amateur baseball.
Gotcha.
So that's how I ended up there.
So being from Rhode Island, was that the only school, or did you tend to look at other schools?
I potentially could have played at University of Vermont. Okay. I liked it. It's cold.
Yeah.
I applied to Boston University in New England. I wanted to stay in the New England area because being from there, diehard Patriot fan, diehard Red Sox fan, which I found out the hard way this is New Jersey, New York area is not the best place to live. But no, I enjoyed it up there. So those are that's predominantly the area that I tried to stay.
So now you become a doctor. So are there other schools involved? How did you become a doctor?
So basically, after University of Rhode Island, I went to Philadelphia College of Osteopathic Medicine, and where I did my 4-year DO degree, and then I proceeded to go to Long Island because I like the islands, and to do my internal medicine residency. I did my internal medicine residency in Long Island, then I went back to Philly to do my sports medicine fellowship through the University of Pennsylvania system. And by the time I finished that whole go-around, most of my family had relocated to New Jersey. Oh. So I planted myself in Monmouth County because I like to be near the water.
Oh, very interesting.
That's sort of how I ended up in New Jersey.
Wow, look at that. So now, was it your goal right after college, I'm going to be a doctor and I'm going to start in New Jersey? When did you start this practice, and how did it become Princeton Brain, Spine, and Sports? So I did not know I was going to end up in New Jersey. I always knew I wanted to do medicine. So the version is basically, in my fellowship, I realized I wanted to do sports medicine. Someone turned me on to the idea of doing sports and medicine. I said I love both. Perfect for me, and I haven't looked back since. So proceeded to do my fellowship, and then after my fellowship, I took on a position working in the Meridian Hackensack system, or at that time Meridian, doing workers' compensation. Mm-hmm. I always knew I wanted to have my own practice. So I started in the Meridian system at that time, and eventually weaned to doing my practice full-time, which was in Freehold. I was in private practice by myself from about 2007 to almost 2 years ago, where I
met up with a friend of mine who was a neurosurgeon, one of the founders for Princeton Brain and Spine, which was a predominant neurosurgical practice, well reputable, good surgeons, and we sort of put our heads together and said, we took each of our scopes of practice, realized where medicine was going in terms of a business, but more importantly in terms of patient care.
Yeah. And
we decided to integrate each other's practices to basically help each other grow our practice in a new avenue, more of a multi-specialty approach to dealing with all aspects of injury, not just neurosurgical, not just sports, offering patients a better avenue and course of treatment for any injuries that they may have. So we integrated our practices about 2 years ago, and since then we've become Princeton Brain, Spine, and Sports Medicine. So my there's one. I'm the one of there's 7 neurosurgeons. We've just added on a chiropractor, Dr. Quill in Lawrenceville. And we have a neurologist, Dr. Maslin, in Langhorne, and I'm the only sports guy. So I travel from Freehold to Somerset and the Princeton locations right now, but our practice as a whole has several locations throughout Pennsylvania, Central and North New Jersey, and even as far as down South Jersey that encompasses neurosurgery.
Wow.
All in network.
And do you do just the sports medicine at each one of those locations?
That's correct. So I'm the non-operative guy. I'm the guy that people see that don't want surgery or have an injury and don't really have a understanding of what they may have and need a workup, right? So sports medicine is not just treating the athletes, if you will. It's the specialty of sports medicine is very broad. I myself, as a primary care sports medicine provider, can treat anyone that's active, anyone with a musculoskeletal injury. That could be, from an underlying systemic rheumatological condition that causes vascular joint pain. It could be an acute shoulder injury from athletics. It could be, sports-induced asthma. It can be it could be an acute knee injury, an ACL sprain, all these different things.
So now, could you do people that are the young age of 6 or 7 to the old age of 85, 90? You get a scope of everybody?
I get a scope of everybody. I work a lot with pediatricians because, unfortunately, most of our injuries and the way our society has viewed sports. Sports is very important, obviously, for kids and growing up in terms of their development. But there's a lot of specialties in sports. Our parents are constant. Every day I deal with patients that come in specializing in their sports, and specialization leads to overuse type injuries. So I'm not a pediatrician, but I do see young kids, probably around 6 and 7 and up, and athletic weekend warriors like myself, to those individuals that have chronic neck and back injuries of the elder age as well. So I'm the generalist. I'm not an orthopedic surgeon, but I'm the general orthopedist that sees all aspects of injury, and wear and tear type of discomfort, and manages them conservatively and manages them based on what my patient's goals are.
So is it more, so you're just telling them if they're going to need surgery, or if do they go to someone else after you?
So, basically I manage their discomfort. I diagnose them, manage them, give them realistic expectations, make them understand what their injuries are and what they can, what is normal to experience, if you will.
Yeah.
And we curtail a treatment plan that's specific to each patient and what their goals are. The example is someone like myself, if I'm playing softball or baseball or volleyball and injure my shoulder and develop more of a tendinopathy or a tendinitis, I'm going to work with rehab, maybe an injection if they need it, some modification of exercises, and then gradually get myself back, or someone like myself, back into their normal routine. For someone that has severe degenerative or arthritic changes in their knees or
Then
backs.
you tell them.
Right, then, well, not necessarily. We manage them conservatively. So we can manage them through diet, losing weight to lessen the load on their knees. We manage them through correct rehab exercises to help improve their flexibility and strength to lessen the load on knees. We add injection therapy if they need it. Because in my field, the treatment is really focused on the individual.
Yeah.
It's not based on x-rays. So, for example, I may have patients that have severely arthritic knees but are able or have relatively good function of what they want to do.
Yeah, yeah.
So in my field, outside of acute fractures, traumatic fractures, most of these things are elective. So if patients are able to get what they want through conservative treatments and modalities,
Then it's fine.
then it's fine.
Yeah.
Everything that's broken does not have to be fixed.
Unless it's a tear or something like that. Then
Even that. Even that. I
Wow.
mean, as we get older, I mean, every diagnosis and every patient is different. When we talk about tears, we talk about acute athletic injuries, such as football players that tear their meniscus or injure the ACL. Most of those patients probably will end up needing some invasive treatment
Yeah.
with the type of injury that they've had. But not every meniscus injury, for example, my meniscus injury may be different than theirs. Mechanism of injury may be different. Mine may be more of a wear and tear type of injury,
Gotcha.
and where that pain is different. So each injury, every meniscus injury, every rotator cuff tear, a non-surgeon will argue that, in statistics and medical data prove it, that not everything needs to be surgically repaired. But so every case is individualized.
Right.
Someone that comes in that's older, that has a wear and tear type rotator cuff tear can definitely be managed, or at least try to be managed conservatively with injections or therapy, modification of exercises, and that may be okay with that.
So now, if it's brain or spine, you're passing them over to the neurologists and things of that sort.
So, so the overlap in our practice is that we have, the spine surgeons primarily deal with spine injuries. We have surgeons that deal with tumors and aneurysms and that aspect of neurosurgery. But the overlap for my practice and the spine surgeons is those patients that they may see that are non-surgical candidates. I can help facilitate the rehabilitation and treatment for these patients that are not surgical.
Interesting.
At the same time, if I have patients that present with spine injuries or spine pain, and they fail conservative measures, or they have certain signs or neurological findings that I think would benefit from a surgical consultation, then those surgeons will see those patients. So the overlap is spine, but there's a large group of patients that I see that are non-spine that I would help facilitate their care somewhere else.
Now, do you find that you get more women that come in compared to men, because women's structure of their legs are, they're more wobbly than men's knees, jumping up and down, that kind of stuff? Do you find more injuries there?
I see. Well, I think it's pretty even across the board. I don't think I can, off the top of my head, say I see more women than men, but I do see a vast array of different types of people. We live in a society now that everybody is, trying to become more health conscious in their own way. And women, I see the types of injuries that I may see with women. There are definitely more women runners that I see in my practice. I see women that are getting involved in gym activities and plyometric, like these Zumba classes and the spin and all of these things. And there's associated injuries that go along with that. To me, it's, there's activity in getting more active, and is your body prepped enough, or is your body strong enough to, number one, pursue those activities, and is your body strong enough to recover from those activities, right? So that's a big educational point that I really try and convey to my patients, is that it's not just exercise, but you need to prepare your body to do the exercise, and you need to prepare your body so that when injuries occur, and they will occur in those most active individuals, your body is able to respond to those injuries.
So do you tell families that their kids come in, hey, your son's been doing tennis all year round, maybe there's other activities that he could do because he's got tendonitis in his shoulder or whatever it is, or a woman runner comes in and that's all she does is run all year round, and do you say, hey, they're only teenagers, maybe they should try other sports just to see, and then the muscles of those sports, aren't they different that you're using for the different sports?
Right, yeah, no, they are. And there's clinical research that says that if you start your kid or child and have them specialize in sports, then the risk of burnout, okay, and the risk of serious injury is increased, 2 to 3 times,
wow.
maybe more, compared to those students or individuals that are cross-trained. Now, I'm not talking, if you take someone that plays soccer and lacrosse using the same body parts, or basketball and volleyball, again, same body parts. But
if they change from football to track to basketball.
Exactly, you're using different body parts. Or baseball. A baseball and a volleyball player, or a pitcher. A pitcher and a volleyball player have the same overhead mechanics, right? They're different seasons, but it's still the mechanics. So that shoulder, not that there's one person serving all the time.
Right.
That is a difference. But you definitely want to cross-train these students to improve muscle tone in every part of their body.
So do you
and also prevent repetitive injury.
So do you give the parents and the students that come to you, do you give them a sense of, okay, this is what you should be doing at the beginning of before you start the sport, this is what you should be doing after you finish up the sport, just so then the muscles relax? How does it all work?
So basically, if I have a parent come in with a dancer, for example, that dances 7 days a week, comes in and they're limping and they can't walk, and dancers' flexibility is always very good. I never have to worry about dancers and gymnasts in terms of flexibility. So for them, it's usually it's more overuse syndrome, and everybody's striving for that scholarship. Everybody's striving for that top 1%, and unfortunately, not everybody is going to get there. So, we have to look at the health of the individual child in this case, and really focus on that, because if you have these earlier, as the kids are growing, their growth plates are open, right? And the more impact injuries they have, the more repetitive strain they may have, their growth plates can get affected. We're talking about not displaced fractures unless there's trauma involved, but micro trauma. There's things called little league elbow, for pitchers who may not pitch, but they may catch or then play shortstop. These are all high demanding throwing positions, right? Or you have, pitchers can get little league shoulder as well. These are repetitive microtrauma to the growth plates of these regions that can become problematic. Same thing in dancers. You worry about stress fractures in the low back, which, if not managed properly,
the toes,
rest, the toes. In ballets. So there's each sport carries its higher risk of injury. And my message to all of these parents and kids that come in is basically your body needs rest. If you look at every competitive league that we have, the NFL, the Major League Baseball, soccer, they're not playing all year round, most of them.
Right.
They have other leagues in different countries, but most of these guys aren't playing all around. And they have off seasons, and they have off seasons to train their body so that they can withstand the trauma during the season.
Gotcha.
In lower level athletics and athletics up to college, there's no off season. There's no getting my body ready for the trauma during the season. You're going from trauma in one sport to trauma in another sport to trauma in another sport. And I think, it's good for the psyche, it's good for the student to a degree, but it does increase your risk of injury.
So is the tendency then to tell students play a sport and then maybe just work out a particular season and then play another sport and then work out?
Ideally, probably yes, but that in reality it doesn't always happen, right? But it's really, for me, it's making them understand, why they're getting these injuries, because it's easy to diagnose an injury, right? But if that injury comes back, it's bad for business. I say that jokingly, but sure. It's that tennis elbow is going to keep coming back. Why does it keep coming back? Well, because we're not fixing the nail in the tire.
Yeah.
Right. We just keep putting air in it every morning. So I really try and focus with the parent and the athlete and the worker to give them an idea of why their injury is happening, and then giving them a plan to lessen the chance of injury. And allowing them, or giving them tools that allow them to treat the injury, if it happens again.
Now, do you also give them a regimen on food, what they should be eating? Do you give them a regimen on exercises, what type of exercises they should be doing?
Yeah, I don't spend a lot of time in terms of nutritional counseling. If I feel they really need it, we go over general basics, but if I feel they really need it, I think and they would benefit from a nutritional consult, I push them to do it. Yeah. Because it really, this is a multidisciplinary approach. This isn't just treating the injury. It's, for older population, it's a combination of weight. It's a combination of what they do for work and their posture. It's not just exercise. It's a whole system that they really have to buy into. It's lifestyle change. Yeah. So our practice and myself, we spend a lot of time in addressing these multi-dimensional or this multi-factorial approach, the multidisciplinary approach, and work with patients either in the office ourselves in educating them about diet or pushing them to see individuals that can give them more individualized attention. I give them exercises to do. I put the ball in their court, and sometimes if I feel that they would benefit from supervised exercises with a physical therapist just to get them off the diving board, springboard a little bit, to give them some confidence. Yeah. And then ultimately the ball ends up back in their court, where you go to class and you got to do your homework. That's sort of the approach I take.
Now, how do they find you? Is it through the hospital system, or do they have to look online somewhere?
Well, obviously the best word of mouth represents the best form of marketing. But our patients today in our society, as you know, being you're on the internet, they're very savvy to the internet. Luckily I've had a lot of patients that have had positive experiences and have shared their experiences on the internet. And a lot of patients are going through the insurance, and insurers have preferred providers based on ratings, and through Google. So I have a lot of patients that come through word of mouth, obviously, but a lot of patients that seek me through different platforms like Google or ZocDoc or other things on the internet.
And if someone's from outside the area of New Jersey, New York, Pennsylvania area, but they still want to come to see you, how's the best way to come to see you? Is it just call up and make an appointment?
Yeah, so we have several options of doing that. Calling up is always an option. We have the ability for patients to make appointments online through our website and through different platforms like ZocDoc to make it more convenient as well. So we try and make it easy for the patients, because calling is sometimes difficult, and sending an email and getting a call back is sometimes easier. So we try and stay up with the times.
Now, do you also go to high schools, do seminars? Do you do anything like that?
Yeah. So having my background, I'm also the student or team physician for several high schools in Monmouth and actually Middlesex, where I work with some of the athletic trainers and the teachers, especially in concussion education. I'm also the team physician for Monmouth University, and also the athletic or the director for their athletic training program.
Oh.
So some of my educational commitments are educating students that are going through the system, but I also do a lot of talks for the community and also for rehab facilities as well.
Great. So we're coming to the end of our show, and usually I ask my guests, what advice do you want to give to students and parents that might have an injury of some sort? What advice do you want to give to them?
Well, I think if the injury is bad enough that forces you to stop and play, then it's something that should obviously be seeked out, and at least by their primary care doctor or pediatrician. Obviously the no-brainer is I was running around the base and I fell and I traumatically hurt my arm or knee injury. That's usually, patients are going to seek immediate medical attention. But I'm talking about the progressive shoulder issues or the progressive knee issues that just aren't getting better even with rest, or they're more painful with rest, or definitely more painful with activity. It's not a bad idea to run it by your primary care doctor and or specialist, just to make sure that you haven't done anything that is crucial, and if you continue to do what you're doing, you're not going to further risk the injury. So
great. Well, thank you very much for coming on the show.
Thanks for having me. Appreciate it.
Yeah. So you've been watching The Secrets of College Planning. I'm your host, Anthony Uva. Until next time.